Hello and welcome to Checking the Vitals, a podcast powered by Specialty Care. I'm Todd Schlosser, and today we are talking to Tina, Kristin, and Jeff from Fairfield Medical Center's Sterile Processing Department. In this episode, we discuss the interesting realm of SPD. We highlight what they handle on a daily basis, sterile processing's impact on patients, and the subsequent achievement of surgeon satisfaction. Enjoy the conversation. So Tina, Kristin, Jeff, thank you so much for joining us here on Checking the Vitals today. I really appreciate it. We've actually never done an episode with an SPD department, so I really have a lot that I want to dig into. Some of it may seem sort of basics to you, but it's because you do it and live it every day. But first off, thank you so much for joining us here.
Thank you for having us.
Absolutely. Happy to do it. So I would like to start out with what is sterile processing department's like scope of focus is? What is it that you guys focus on day in and day out? And really anybody can start.
Obviously, sterile processing focus is providing good, clean, sterilized instruments for a broad spectrum of procedures, both surgically or across the health system. It could be in an office. It could be for providing sterile instruments for a cath lab or in the ritual lab or the OR. They have a wide range of things. What the focus is to clean and provide an instrument for its intentional use in a clean and sterile environment zone.
Yeah. So it sounds like it's not just for ORs, for operating rooms. It's for sort of any like surgical centers or anything that could be, I guess, anywhere a patient could be having an operation, right?
Right. Or a procedure.
Yeah. Okay. So from a quality standpoint, in your roles there at Fairfield, how do you determine whether your sterile processing department or central sterile or whatever you guys want to call it, how do you determine that you guys are functioning correctly as a department?
Well, actually, that is a big part of Kristin and I's job because we are infection control. So sterilized equipment or instruments, it is vital to us not seeing a lot of infections in our patients and so forth. So that is, not only do we go down and just visually look at the process, look at logs, make sure everything's working as it should, but we also see the other side of it with our patients. Are we experiencing any infections?
And now when you say infections, I'm assuming you mean post-procedure, post-operation infections. So maybe that's a good place to start. So what are some indicators of a sterile processing department not functioning correctly? So it's things like those infections, like what does that look like at that hospital level?
Well, if we have an infection in a patient after their surgery, like within the first few days, they're not even at home yet to where they could have contaminated their site or whatever, right. Then we can look to see, or if we have a increase of infections in a particular type of surgery, then we can look at those instruments, how they're being processed, even down to the people in the room, what room's always being used to make sure the environment's clean as well. It's just, there's so many different steps to it. I don't know that it would be, unless it was a really big outbreak of infections, might be harder to really drill that down to a specific instrument, but
sure.
That it is all part of it.
Yeah, well, I'd imagine it's not just, the instruments that could cause an infection in a hospital, right? So there's probably a lot of elements at play there. Obviously, you'd want to make sure the instruments are sterile and, right. Good to go before using them, which is what you guys do. But it also could be the room that they're in after, post-surgery, that sort of thing, right? So, but what quality systems and controls are in place to make sure that the central sterile department is always putting out equipment that is sterilized, that is ready to go?
It's monitored in surgery. So when they open up the packs in surgery, they monitor to make sure that the indicator changed, that the sterilization did occur. They look at the instruments to make sure that there's no debris left. They just make sure that everything looks appropriate to be able to use the instruments for the surgery. So there's a lot of checks and balances there to make sure that the equipment and the instruments are ready to be used, that they were done correctly. And we have that in place. We have the staff look at the indicators to make sure it's sterilized. They check all the equipment. If they find something that's not, then they'll remove it from the surgical table, and then it goes back to central processing to get, re-sterilized. We also place incident reports in our system. So then that way we can track those events to make sure there's not a lot of like an increase in instruments not being appropriately disinfected and sterilized. So just so we have checks and balances to make sure we're protecting our patients. So.
And I'd imagine, and clearly correct me if I'm wrong, but as you're setting up for surgeries, you are building sort of the instrument table or instrument set that the surgeon's going to need upstairs or wherever the OR is, right? Based on the surgery they're going to do, so that you've got the exact number of equipment that they need, because as you clearly know, but all surgeries are not the same, right? So you need different instruments.
If different trays.
Doing, a heart surgery, you have like an instrument set for that specific type of heart surgery. So the SPD department is responsible for like almost the prepping of the case from an instrument perspective. It's not just cleaning them, right? It's literally putting the case together. It is that cleaning it, but it is putting the case together and sending it to the OR. And then I'd imagine that someone in the OR, maybe the surgeon, maybe the physician assistant, is going through the instrument to make sure they're sterile. Is that sort of the workflow? And then if they're not, they come back.
Right. When the tray comes down dirty after it's been used, it goes to a decontamination room, which actually takes off any fluids or anything from it. If they use an enzymatic that cleans it. And then it goes to another process, goes to a wash and comes out the other side to where that team actually assembles all the trays with hundreds of different instruments. And they have to know what trays what and what goes in it. And they have little menu cards to help them remember. And they're checking for instruments. If there's a breakdown of an instrument or that they would have to take out of service. And then once they get that tray put back together, they have to wrap it correctly. Put the indicators all in it that needs to be there, wrap it correctly, then put it through this sterilizing machine, a piece of equipment. And then even as it's stored, there's specific ways of storing it. We have to watch temperature, humidities, all that, where it's being stored.
And I'm sure that there are a lot of reasons as to why all of those procedures have to be followed. And I imagine a lot of that is like bacteria based. Maybe that's not the right way to say it, but if you don't
any organism.
Yeah, exactly. So if you don't follow these steps, it could impact a patient negatively through an infection or whatever. And I've had the opportunity of touring an SPD. It was at a hospital in Kentucky, and I was blown away by the intricacies of the actual instruments. Because it's not like you're cleaning a scalpel like you would wash a fork, at like your sink at home. Like I literally watched someone clean one of those cameras that goes inside someone, and like they're very small, very intricate, and they had 3 different types, and they had 3 different procedures for cleaning each one of these cameras. So can you speak to some of the variances that you see from how you clean all the different kinds of equipment that you guys put your hands on every day?
Well, like I said, some of those are solid surface, which are a majority of the instruments. You have, like you were probably talking about, there's laparoscopic instruments that are also have areas that they can put channels in for equipment to go through to operate. So, and those use different sterilization techniques and different cleaning techniques as well. You have instruments that are rigid, you have some that are flexible. So there is a variety of that. And like they were talking about earlier, there's a variety of sterilization methods. And one of the things that we also do from a quality perspective too is to track to make sure that the machines are operating like they should be, that all the instruments, or whether it's a flexible piece of equipment or a rigid piece of equipment, it's going to be exposed to the right elements so it gets sterilized. And the ones that are most challenging are those that have channels in them. To get through a little 3 millimeter hole, there's certain sterilization equipment to do those in. Also, when you're using with microscopic instruments, like for a vascular procedure, sometimes those tools can become magnetized. And so they come down, they have to get demagnetized, because what happens is the needle will stick to it. So when a surgeon will put it through the vessel, if it sticks to the needle holder, that's not a good thing as well. So they have to demagnetize things. They have to soak instruments, put in what we call in a milk, kind of like a WD-30, if you will. But it's a white substance that they put them in that helps. Water quality is important. They measure water quality to make sure that's because that can fit the instruments like she was saying. So
we were fortunate to be able to go down and actually put a tray together. So we were able to see all the different parts and pieces and how much the staff have to be educated on. Because I mean, one instrument may be, there's 3 different sizes or different shapes, or it's just
surgeon preference.
Yes, that too. So it's a very detailed oriented type of position, and they're very vital to the hospital. And that's something we've learned over the years in this job that we've been doing is infection control, and how important that role is to our facility.
Can I ask a little bit about that specifically? Because when I first started in the capacity that I am, I overheard a few people say that sterile processing departments were like the dishwashers for hospitals. And I didn't know any better at that point. And I was just like, oh, okay. I mean, I worked at a restaurant in college. Like, I guess that sort of makes sense. But when I went and saw them, I was blown away, sort of like I talked about a second ago, by how intricate these machines are. And I didn't even think about surgeon preference. That makes sense too, though, that they would have to know that sort of thing. And that sort of thing is very like where you're working specific, like hospital specific, the surgeons that work there. So I guess, how long does it take for someone to start, on entry level at like sterile processing department? How long does it take to get them like trained up to where they're doing the job on their own every day? Because it seems like it would take way longer than it would like if I got a job at a Ruby Tuesdays as a dishwasher.
Very much so. And we take this is a very important department.
Yeah, it is.
Here at the health system, as it is in many health systems. For us to put somebody through a program, minimally it starts off with 8 weeks.
Yeah.
But that is going through the didactic and that type of thing, but that's an 8-week minimum. Then they can kind of take a pre-certification exam just to see where they are relative to understanding what they do, how they do it, why they do it, when they do it. And they can take a preliminary test at that time. Then it's another 6 months or so later, they can set for certification. And here, that's so important to us. We want all of our processing staff to be certified. So they went through the basic training in knowing about the formation of instruments and how they're made and why they're made. And all that type of thing. So minimum of 8 weeks, but it takes them longer to get that certification.
Yeah, I know a lot of jobs in the healthcare field, you can start out and you can do a little bit of work in it, but there's like a requirement that you get certified in whatever it is that you're doing within like a year, 18 months, or however long like a lot of typical training programs are. Is it not a requirement in other hospital systems to get certified in central sterile or sterile processing?
Yeah, not all hospitals require it.
Oh, wow. Okay. So you guys, would you say that you guys are the norm at Fairfield and that you do require it, or do you sort of stand out because you require it?
I would say that we're becoming, just as all other health systems are becoming part of the norm.
Okay.
As we're requiring certifications for many other types of other modalities, whether it's a nurse or tech or radio sonographer or whatever. But more and more in healthcare, you're seeing requirements for certifications.
After seeing that SPD department at the hospital in Kentucky that I went to, I definitely think that they need to be certified just because there's so much that goes on there and so much that can go wrong if the job in that sterile processing department is not done correctly. And that boils down to just a lack of training, I think, in a lot of cases, if something isn't done correctly. So
you're exactly right. So outside of just the infection control part of it, again, when they were talking about the assembly of the instruments, if that's not done correctly either, and it's in a surgeon's hands, there could be injury to a patient. There could be injury to the physician, could be injury to the scrub tech that's in the room passing the instrument. So it's also just as important to make sure that they're putting out an instrument that's going to work properly.
It can delay a patient's care too, because if we don't have an instrument or they need something, then they may have to kind of pause in the surgery, and so it just impacts so many different aspects of the surgical procedure.
I know surgeon satisfaction surveys are a big thing in a lot of hospitals. And I would imagine that, a quality SPD department really improves surgeon satisfaction because they're not waiting on instruments. They're not pulling up instrument trays that are not sterilized correctly. They can just get in there, they can do their job, and then they can focus on other things, which I'd imagine is sort of what they want to do. So do you guys focus on that in your capacity at Fairfield? that service
They do.
satisfaction component?
Our sterile processing manager and supervisors huddle with our OR team every single day.
Okay.
Anytime there might be an opportunity that may bubble up through the day, the manager definitely comes up and has a conversation with the surgeon. So there is immediate follow-up with the surgeon. It is very important for us to make sure they have everything they need it when they need it at the right time. So yes, it's very important.
Yeah, absolutely. How do you think that having a quality sterile processing department sort of plays into the hospital as a whole's reputation? Like, is that something that you think the public thinks about when thinking about a hospital?
Well, I'd say any kind of infection, they may have different. I can't put myself in the public side to answer
Sure.
specifically, but absolutely. One of the inputs to that is the sterile processing part of it. So any infection in any community is a negative reflection on the system, and depends on the patient's perspective, whether it was a surgical patient, they may think they got it from SPD. So it is important from that aspect that we do everything the right way every day.
Yeah. I mean, I can't think of a higher stakes job than, surgery. And if you go in there with faulty tools, just like a mechanic, it's not going to go the way you want it to go. So you have to start with a solid foundation. And I feel like the SPD is that solid foundation of, setting up the OR team for success.
Correct.
100% agree.
We agree.
So is there any sort of organization that oversees all of this from a nationwide perspective for all hospitals?
We use Joint Commission, so they actually come. It's usually a triannual survey. So they typically come every 3 years. And part of that, they really focus on, especially the last 3 years when we had our last survey, and nationwide, they're really focusing on sterilization and high-level disinfection. So there are certain standards that they put out, but they're basically primarily what CMS follows. So Joint Commission is just here making sure that we're meeting all of the CMS requirements. So we do have different standards we have to meet, and they will look at that to see if we're meeting the standards or not. And so, it's just really important on the temperature of the room, the humidity of the room. Are the instruments taken apart? Are they string the instruments to make sure that when they go through the sterilizer that they're open, that it gets all the different parts and pieces of the instrument cleaned and disinfected appropriately. So we do audits in our central sterile department to make sure that we're meeting all the standards that Joint Commission puts out. And that's something that the manager of SPD does currently every month. He reviews different standards to make sure we are meeting those. If he feels that there's an area we may not be, then he will put out action plans on how we're going to meet that standard. So there's just a lot of different regulations that we follow just to make sure all of our instruments and all of our areas where we do high-level disinfection, we're following the standards to meet the demands that we need to follow.
So it sounds like that Joint Commission, when they come in every 3 years, it sounds like, right?
Yes.
They do sort of a full audit of your quality control checks and just make sure you're up to the standard that is required, right? But it sounds like you guys also have a process in place where the SPD manager does it once a month. Are they doing it for every, do they do one check on, let's just say, are the humidities in the right place once a month? Or are they checking everything once a month?
We do a lot of our checks every single day. So
oh, wow. Okay.
Yeah, the humidity, they look at humidity, temperature, like Jeff mentioned, all of the machines to make sure that they meet the quality standards. And then we keep books and records of all of that to make sure that we met all the different quality checks for equipment. And so that's something the Joint Commission will review. They'll look at that. They look at how we store the equipment. They go up to the OR and watch them open trays. They go watch a surgery. They make sure
they look at the logs to make sure that it's something that we are doing every day.
So
okay, wow.
Thorough. Depending on the size of your facility is how many days that they come for. So we're around 4 days survey, I think 4 to 5 day survey.
Oh, wow.
And they usually send like 3 to 5 people that will survey different parts of the hospital.
Okay, so that sounds very, very in-depth.
It's right there.
Yeah. Well, and it sounds like you guys are sort of doing those steps every day too, to make sure that you're delivering that quality, SPD that, is sort of required to run a hospital the way it needs to be run.
Right.
Well, safety is always number one.
Yeah.
And that is definitely Central Sterile falls in that safety area. And Kristin and I have been in infection control for about 5 years, but it didn't take us long to realize our environmental services department and our SPD department are both vital to stopping spreads of infection, or it's not just to make the building look nice, they really have a very important role.
Would that be the people who actually go and clean the rooms and things like that?
Yeah.
Yeah, absolutely. Because sort of like we talked about before, infections that happen in the hospital may happen because of the SPD, but it may be any number of things that happen that are sort of outside of SPD's control, based upon where the patient is, how they got moved into surgery. I mean, the bed they were put on when they were wheeled in and out like that. All of those things can come into play. So all of those things, of course, are important. That makes complete sense.
Yeah, but I mean, and it's those positions that your general public probably don't even really know too much about, or have a big understanding of, or even realize what they do, but is very, very important.
I would think for most people that are in what I would call the public, right? They don't even really think that an SPD exists. They think it must, but they don't really think about it day to day. Like when they think of like outcomes for surgery, they don't think, well, how clean were the instruments, Although
Right.
I feel like that's a very big part of what plays into a successful surgery.
That's what we were talking beforehand. We're like, maybe people may not even realize that it's a reusable instrument. Like maybe they think we get new instruments for every case, or I don't know. I don't really think a lot of people have a knowledge of.
I just don't think they think about it, which is okay. I mean, if I was going in for heart surgery, I'd probably focus on, I've got to have heart surgery. Right? So I understand the lack of awareness around it. I just think if more people knew about it, I feel like the SPD would get the respect that I think it deserves, because it is much more than just like washing a fork and a knife, like you would do at home, because you're like cleaning Da Vinci machines. And these things are very intricate and very, I mean, I don't know that I could even take one apart, let alone put it back together. And you have to do that to clean it. So I have a few questions around how a successful sterile processing department might operate. So I'd imagine you have the people actually doing the job, the people who are washing the instruments, cleaning the instrument sets, and then you have a manager of those. Where does that report to in most hospitals? Like in Fairfield, who does that manager sort of report to?
Well, my history has been it reports up to the director of the OR, like myself.
Okay.
Typically, a lot of hospitals, sterile processing departments will report up through perioperative or surgical division. Typically.
Okay.
In addition to the manager, depending on the size of the sterile processing department, they may have a supervisor that works on the day shift and one that works on the evening shift too.
Okay.
So the manager's not there the entire time the unit is open. And so they have a subset of leadership of supervisors, what we call them, or team leads. Okay. And they're working with the sterile processing staff to assure this quality things we're just talking about, and staffing and all those other things.
Okay. So where does quality checks and that sort of thing fit into the organizational structure of central sterile or sterile processing?
The quality checks is something that, again, we as an organization with these two fine ladies here, we report out our monthly statistics. Mm-hmm. And like you said, we measure every single day, but we're reported out at a standard quality report out every single day. It's led by these two young ladies. So the manager of our department here from sterile processing brings that data forward and reports out on it, and opens it up to the rest of our quality team here at the health system. They ask any questions, or if they have things that they want to be knowledgeable about. So he provides that for them on a monthly basis.
So when you say report out that data, who are you reporting that to? Is it just like the hospital leadership?
We have an infection control meeting, and so we meet quarterly, and so we actually show all the data from central processing, along with a multitude of other things. But that's just one part of our meeting. It just goes over, they talk about their error rate. There's ISS or
IUSS.
Yeah, IUSS. So it's where they used to call it flashing. So it's kind of like a quick turnaround processing of an instrument. They kind of have a smaller, kind of like on your washer, you have the regular and then the quick wash.
Yeah.
So it just allows the equipment to be, the instruments to be sterilized much faster, but it's not really recommended because we would rather it go through the regular process.
Sure.
So they report that out. We want it to be below 1%. So there's just different quality measures that we do report out so we can see the improvements they have done and make sure that there's no issues ongoing. It's part of that checkpoint too for Joint Commission. Allows us to see what the results are and keep everybody in line to make sure we're meeting our standards.
Sure.
And all that, I think what the people in the meeting that we're reporting to,
Yeah.
our infectious disease physician, our
Okay.
nursing officer, multiple directors from all of our different areas. We have actually a pretty decent sized meeting, but then our meeting minutes go to as far up as our board, but it goes to a quality team and it is reviewed at our quality team meeting. And then it goes up to the board for the hospital.
I guess my follow-up question would be, is there a way that SPD departments can, and maybe network isn't the right word, but share best practices with each other? Is there a system in place maybe through the Joint Commission where department leads can come together and talk about the best way to handle certain situations and things like that? Or does that infrastructure not really exist yet?
Not through the Joint Commission, but it's not uncommon in the sterile processing world for them to be connected with other health systems and reach out to them periodically with questions and ask, say, hey, what are you doing about this opportunity if there is one? Just like a lot of our nursing, there are clinical organizations that they can become members of, and their networking occurs as well.
Okay.
It's AMI standards, correct, for central processing.
Yeah.
So central processing has to follow AMI standards, and so they do have ways through those standards to reach out to other people in their department. So.
Okay.
But the nice thing too, if Joint Commission comes and that they see something, the team that will come, if they see something at your facility that they think that is unique or best practice, then you can submit information to the Joint Commission, and then they will send that out and say, hey, this is a best practice, something that they're doing at this organization that other people can use. So there is an option through Joint Commission too.
Okay. Well, that's all the questions I had for you all today. So Tina, Kristin, Jeff, thank you guys so much for joining us on Checking the Vitals and really illuminating what goes on in a central sterile or sterile processing department.
Great. Thank you very much. Appreciate your time.
My pleasure. Thank you guys. Thank you for listening to Checking the Vitals. If you enjoyed the content we provide, please leave us a 5-star rating and review. It really does help people find the show. And make sure you subscribe so you hear our interviews with healthcare innovators every Monday.